Hey guys, we did our presentation on end of life care considerations in the Hispanic community. Hispanic patients are particularly vulnerable due to their access barriers to adequate care. They may also have had negative experiences in the past with discrimination, feeling misunderstood, and being disrespected by healthcare workers. We nurses are able to change negative past experiences into positive ones. We are able to provide our patients with information and initiate the discussion when it comes time to discussing end of life decisions and end of life planning. It is important to introduce yourself to your patient and gain their respect. An example would be, Hola, buenos dias, mi nombre es Courtney, ¿cómo se llama usted?
It is never easy to discuss end-of-life decisions. Several boundaries that make the conversation even harder for the Hispanic community include poor advanced planning, lack of health insurance, and language barriers with physicians and medical staff. It is important to know cultural norms when beginning these conversations since their beliefs and wants will more than likely differ from our own. To evaluate if a patient understands English, you can ask them, ¿Entiendes inglés?
When thinking about hospice care for a Hispanic patient, it is important to note that they are less likely than Caucasians to use hospice, even though there is evidence their need for hospice services are greater. Compared to Caucasians, Latinos are typically undertreated for cancer pain, and Latino caregivers have more depression during bereavement. The Hispanic community is the largest minority group in the United States, and although efforts have been made to reach out more for hospice care, Latino patients still underutilize the service. When addressing the patient and family, you can ask them how they feel by saying, ¿Cómo te sientas?
Latino patients do not like to talk openly about death. Talking about death and end-of-life decisions causes them much anxiety and stress. Latino patients feel that truth-telling about their prognosis is cruel to the family and harmful to them. The patient will request not to be told information and prefers their family be told so they feel protected. End-of-life decisions will be made by the family and not the patient. Latino families also do not want to be given pamphlets on what to expect in the final days of hospice care, as they feel it is very dramatic and they do not want to be told what all their family members may experience.
As healthcare workers, we need to know how to discuss impending death with our patients and their families. It is hard to do so with cultures that do not want to talk about death. Some strategies for Latino patients include raising their level of knowledge about hospice and providing proper education. If they are more educated on the benefits and what all hospice care involves, then maybe it would not be as hard on them or their families. Each patient needs to have a case assessment tool which will allow the healthcare team to understand their family values, attributes, education level, and their communication preferences. Social workers, hospice staff, or other members of the Latino community may be helpful to help navigate the patient and their family around end of life decisions and care. After providing information to assess if your patient has any questions, you would say TNA's preguntas. It is important to be culturally sensitive and try not to use words such as death or terminal, as they will only cause more anxiety and fear.
Family is the most important social unit within the Hispanic culture. They are the primary sources of support for each other and are close-knit and independent. When important decisions need to be made, they do not just include their immediate family. It may also involve godparents, grandparents, cousins, aunts, uncles, and sometimes close family friends.
Personal care should only be provided by an assigned family member. Patients and family members view life-sustaining measures as futile, prolonging the inevitable, and causing more suffering. Family members place a lot of emphasis on making sure the patient is pain-free and that they feel respected. If the patient is still able to communicate to assess for pain, you would ask TNA's dolor.
Most Latinos identify as Catholic. They exhibit a strong faith in God. Religious faith has a large impact in understanding health and disease and is a crucial source for accepting dying and grieving. Latinos believe that whatever happens will be meaningful and turn to God for comfort and hope. If you are in a hospital, it is important to offer chaplain services to the family. Patients and their families may request last rites or anointing of the sick administered by a hospital chaplain or the family priest.
It is important to be aware of the religious needs of your patient in times of impending death. Some religious considerations include group praying or religious masses. Cleansings are conducted by healers who are able to clean the body from disease using praying, plants, animals, or eggs. Also, mandas may be observed, which are offerings to saints where prayers or material things are offered in exchange for health or miracles.
Latinos are very religious and spiritual. Death is not seen as an end, but more a continuum of life. They perceive a relationship between the living and dead. It is not uncommon to hear someone speak of the dead as if they are still with them. Since they expect death to happen at old age, most do not have advance directives. They feel if they start planning for death, then it will happen sooner. They also feel like they do not belong to the United States. For this reason, when they die, they prefer to be sent back home to be buried.
The Hispanic culture freely expresses their emotions. Crying is considered a healthy and appropriate response. It also shows respect. An expression of grief that is sometimes seen among some Latino cultures is ataque de nervios, which is shaking of the body in order to release the pain of loss. Touch shows respect for the bereaved and may be an important gesture for healthcare providers to use in showing their support to the family.
Once the patient has passed, the family may prefer to cleanse the body and prepare it for sending it to the morgue. Wearing black or dark colors is a common way to mark luto, which is mourning. During mourning, immediate family members usually do not play the radio, watch television, and attend movies, dances, or other social events. Family members and friends may perform prayers for the deceased at various intervals. Prayers for 9 consecutive days, novena, once a month, on All Saints' Day, November 1st, and All Souls' Day, November 2nd.
El Dia de los Muertos is a holiday to celebrate those that have passed. Families and friends go to the grave sites and bring food and symbols to honor their lives and celebrate unity in the family. You will also see decorated altars with pictures and mementos for the family member. And here is our references.